Okay, again, good afternoon. And we have to continue our discussion on Module 2. Okay, Module 2 is about documentation. Now, we know that the PT or physical therapists are the integral part of the healthcare. Their team is an important entity in the healthcare because they optimize the movement and function after an injury or disease. So they are hands-on professionals. They evaluate the movement, the function, and they develop care plans as well and use therapeutic exercises. They facilitate neuromuscular control and movement and also manage pain as the part of the treatment for their patients. Now, there are the 9 types of specialties in physical therapy. The first specialty is pediatrics. So when we say pediatrics, they are working with a range of children. So this is from newborn to teenagers. So children who have variety disorders and conditions that inhibit their functioning of growing as they should. So commonly we found this in children who have developmental delays, cerebral palsy, cystic fibrosis, scoliosis, and the brain injuries. So these physical therapists are working with children from newborn to teenagers, those who have problems like developmental delays, those who are having cerebral palsy, cystic fibrosis, and scoliosis that will inhibit their functioning or growing as they should. The next specialty is the sports. Okay, this is the second. Athletes who have sustained an injury after an athletic activity. So this physical therapists, they specialize in sports medicine to alleviate and heal the injuries while engaging in an athletic activity. And the common sports injuries includes ACL tears, concussion, a tissue elbow, hip flexor strains, shoulder injuries, such as dislocation of the joint or tearing of the rotator cuff. So physical therapists use strengthening, stretching, and manual therapy. They also use hydrotherapy, the use of heat and cold application to restore the functioning, the movement of the client in the affected areas. And they also help to return to their peak performance for restoring muscle strength, improving speed, quickening our reaction time, and improving agility are often on the areas of focus. So our physiotherapy, they also specialize in sports medicine to heal the injuries, to alleviate the pain while engaging in athletic activity. The next is women's health. Physical therapists can specialize in women's health. And this refers to both specific condition of women facing as well as the treatment of women in different stages of their life. And this condition, such as pelvic pain, right? They specialize and work or treat conditions such as pelvic pain, osteoporosis, and lymphedema after surgery or after mastectomy. And they also provide prenatal and postnatal care. Now let's go to geriatrics, or they are working with elderly patients. This is to alleviate pain from arthritis, osteoporosis, and general joint stiffness and soreness. So the goal of the PT is to help these patients remain physically healthy and active as possible. There are geriatric patients may have progressive disease, and we call that degenerative diseases such as Parkinson's, Alzheimer's, that they have no cure, okay, because it is the damage of our brain cells. And we know that the neurons, once it's damaged, it cannot be back in their normal functioning. So they don't regenerate anymore. So this Parkinson's disease and Alzheimer's that have no cure and will impact everyday activities. So they help those elderly work with patients, build their muscles strength, improve their balance, and help them to prevent from fall. The fifth specialty is clinical electrophysiology. This compasses two distinct types of treatment. We have the electrotherapy and wound management. So these are under clinical electrophysiology. Electrotherapy involves the use of EMG, or we call that electromyography. It's a procedure that's used to determine the health of the muscles and nerve cells using electrodes. So we are using electrodes in EMG. This is to determine the health of our muscles. The EMG also measures the electrical activity of our muscles. PT practicing with this specialty may employ electrotherapy to help treat the patients or use the electrical stimulation that can help prevent blood clots, facilitate wound healing, relax muscle spasm, improve blood circulation, and alleviate pain. So the common wounds treated by electrotherapy includes abrasion, post-surgical incision, diabetic ulcers, and lacerations. The sixth specialty is cardiovascular pulmonary. When we say cardiovascular, this is the therapist's specialty to provide cardiac rehabilitation for patients that suffered from stroke, heart attack, and simply looking overall cardiac health. The cardiac rehabilitation therapist helps build patient endurance through exercise, teaching patients how to provide education in a long-term management and condition of the disease. It reduces stress and manage the condition. And another specialty is the pulmonary, and they provide services like pulmonary rehabilitation. So physical therapists who provide the care with patients who have pulmonary conditions such as chronic obstructive pulmonary disease, or we call it COPD, cystic fibrosis, and sarcoidosis. Physical therapists teach these patients breathing exercises, work to strengthen muscles, and endurance. And we have the seventh, which is neurology. Neurological physical therapists work to treat conditions of the nervous and the spinal nerves. So They are specializing to treat conditions of the nervous. When we say nervous and spinal, it involves the brain. So patients have a range of afflictions, including brain or spinal cord injuries, multiple sclerosis, sciatica, neuropathy, fibromyalgia, and cerebral palsy. So these conditions may inhibit patients' balance, coordination, sensation, and overall movement. This PT can specialize in neurology in the variety settings. They can support patients that have recent brain or spinal cord injury. They work in acute care and rehabilitation center for long-term therapy, and they may work in assisted living facilities assisting elderly patients. The eighth is orthopedic. So what is this orthopedic specialty? This is concerning orthopedic physical therapy, which is treating condition of the bones, the muscles, the ligaments, the tendons, and the joints. They may see a range of patients such as who are suffering from arthritis, those who have broken bones, those who have joint replacement surgery, and those who have strain, sprain, or any muscle or ligament. So these therapies may treat anyone, not just only athletes who have suffered from an injury due to an athletic activity, but also they treat methods such as stretching exercises, strength training, this hot and cold application, and electrical muscle stimulation. Okay, so we have to sum up the ninth spiral. We have the oncology as the last. Oncology refers to the study and treatment of the different types of cancer. Physical therapists within this specialty work with patients who have been diagnosed by cancer and who are over recovering from cancer. And this may include conditions that require physical therapy, pain, muscles, joint stiffness, loss of endurance, and walking, difficulty in walking, numbness of the feet, and hence loss of bone density that occurs as the result of